Hello and welcome to SRG's Medicine. Today, in this video on Respiratory Medicine Series, we shall be talking about hemoptysis. So, the contents of this video are definition, pulmonary circulation, causes of hemoptysis, and finally, summary. Let's start on with definition. So, what is hemoptysis? As you can see here in the picture, hemoptysis is the expectoration of blood or blood-tinged sputum from lungs or tracheobronchial tree. So as you can see here in the picture, it can be blood itself, or it can be simply the blood-tinged sputum, that is reddish or pinkish colored sputum, as we see in many of the pulmonary conditions, such as streptococcal pneumonia, pulmonary edema, etc. So talking about pulmonary circulation. So pulmonary circulation here. The thing is, lungs are supplied by two two type of arteries, one being pulmonary artery and another being bronchial artery. So the pulmonary artery has low pressure. So it is a low pressure system, whereas bronchial artery is a high pressure system, which has the pressure equal to the systemic blood pressure. So here, the significance over here is that during hemoptysis, most commonly injured artery is bronchial artery. So if the high pressure system is injured, then that will lead to greater velocity of the blood oozing out. So what are the causes of hemoptysis? Here, I'd like to tell you that I have classified these causes of hemoptysis on different headings. And these headings are based on the management or diagnosis scenario. So the first group is bronchial diseases. Second one being parenchymal diseases, then vascular diseases, cardiac diseases, and ultimately hematologic diseases. So let's move on to bronchial diseases. Talking about bronchial diseases, the causes can be acute bronchitis, bronchiectasis, carcinoid tumor, foreign body, or bronchial adenoma. Acute bronchitis is one of the most common cause of hemoptysis. And carcinoid tumor is quite essential because in carcinoid tumor, the bleeding is massive. So parenchymal diseases being a cause of hemoptysis can be tuberculosis, which is the most common cause of hemoptysis in developing countries. Lung abscess, whether that can be aerobic or anaerobic. Parasitic infections such as Paragonymous westermanni infection, hydatid disease, or amoebic liver abscess causing disease which might extend up to lungs. So the fungal infection could be actinomycosis, mycetoma. And finally, there can be trauma. Here, I'd like you to note that the trauma over here that we are talking about can be sharp stabbing injuries, or it can also be inhalation of some irritants or toxic fumes. Not only that, but it can also be some kind of blunt trauma, which might not seem to cause any kind of bleeding externally, as in the case of motor vehicle accidents. So now the other category is vascular diseases. Vascular diseases include pulmonary infarction, pulmonary embolism, Goodpasture syndrome, arteriovenous malformation, and different types of vasculitis. So here in Goodpasture syndrome, there is formation of antibody against collagen fibers, which leads to weakness of interstitial tissues. Now that will lead to increased chance of rupture of artery, thereby causing hemoptysis. So in vasculitis, the two most common causes of hemoptysis included in vasculitis are Wegener's granulomatosis, which is also known as granulomatosis with polyangiitis, and the other one is polyarteritis nodosa. So talking about another group, that is cardiac diseases. So the cardiac causes for hemoptysis are acute left ventricular failure, aortic aneurysms, and mitral stenosis. So the next group that we'll be talking about is hematologic conditions or hematologic diseases, which includes use of anticoagulants, hemophilic condition that can be acquired or that can be genetic, For example, hemophilia A, hemophilia V, von Willebrand factor disease, Christmas disease, etc. So it can also be due to leukemia, and it can also be due to disseminated intravascular coagulation, though it is rare as a cause of hemoptysis. So the summary of this video would be: hemoptysis is the expectoration of blood or blood-tinged sputum from lungs or tracheobronchial tree, which might be caused due to various kind of factors, which includes bronchial diseases, parenchymal diseases, vascular conditions, cardiac or hematologic condition. But among these, the leading causes, which account for almost 80% of the cases of hemoptysis, are tuberculosis, number one in developing countries, acute bronchitis, number one in developed countries. The other ones include bronchiectasis, pneumonia, and various kinds of tumors. The thing that is of clinical importance of this slide here is that evaluation and management plans of hemoptysis is a unique one. Here, I've kept it in blue. And let's again recall that it is something of clinical importance that we'll be talking about in the coming video. Hope you enjoyed it. Thank you. And please do comment your feedbacks or any questions.